Hello, everyone. Dr. Kelley here at I Care About Health Tech with iCare Nursing Solutions. My name is Tiffany Kelley. I'm the founder and CEO of iCare Nursing Solutions. And I'm also a nurse and healthcare professional of nearly 25 years with board certification in nursing informatics, and over 20 years in health IT, including my PhD. And what I wanted to talk today about was thinking about artificial intelligence and nursing. It's a topic that's got a lot of attention right now for the right reasons, right? There's a lot of discussion around it. There's a lot of what I would say conceptualization around where are we going? Where can this emerging technological space be of a impactful, positive change to healthcare delivery? And I was attending an event recently that was not a healthcare related event, and it wasn't about patient care, but I have been immersing myself in different things that are discussing how AI may or may not be used to really start to get a better picture of, what is possible, as well as what are people saying about it? What are people talking about it? How are they thinking about it? And one of the things that was said from this one individual in particular was looking the desire to find the individuality and humanity of the person through artificial intelligence tools. And the context was primarily around chatbots. And as a nurse and healthcare professional, I internally thought, I don't know if that's what I would suggest for healthcare. Actually, I don't think that I would at all. Instead, I would wonder, how do we connect? How do we use artificial intelligence to connect humans better? So, that slight nuance of difference, because the first example of being able to use AI to get at the humanity of a person suggests that the technology would be able to some degree, replace that human connection. When we're talking about nursing and healthcare, some of the strongest um, roles we can play as nurses and healthcare professionals is that nurse or healthcare professional patient relationship that we're able to develop with the aid and support of data, information, knowledge, and wisdom. So I'm going to step away from healthcare for a moment to give an example, just to sort of put some perspective on this. So the other day I happened to leave my keys somewhere, and I have a AirTag on in various different places. I have one with my luggage when I travel. I have one on my keychain just in case I lose my keys. And I have one in my car, right? So I have them in these places where, if I'm away and coming back to the airport and I don't remember exactly what floor I parked on, I can go to my phone and do find my car. My luggage, thankfully, I've not run into that getting lost, but if that was an issue, I would be able to track that. And then, of course, my keys. So the other day, I happened to leave my keys behind somewhere, and I went right to my phone and Find My. And I said, where did I thought I knew where I left them, but I wanted to be sure. And the map showed me exactly where they were. And what I could do was locate them. I could locate them based on the little dot, but it didn't mean that somebody, um, you know, couldn't have moved them or taken them or something. So I got into the store, and there I saw them behind the counter. They were behind the counter, meaning somebody, a person had intervened and held them because they knew somebody was likely going to come get their keys. And, there you have the technology that's able to connect me to find the thing, but the human that's able to get that extra layer of personalization and thinking about somebody's going to come back for these, let me put these over here, right? And that I think is an incredibly important distinction between where we as humans have a upper hand. That might not be the right word, but have the ability to supersede and or oversee the development of these technological tools to be able to say what we do want it to be able to do for us from a data, information, knowledge, and wisdom perspective, and I would even say augmented wisdom, um, to where we could be better humans, right? So, how can we be better nurses, doctors, physical therapists, occupational therapists, pharmacists, medical assistants, aides, whatever the role might be? How can the introduction of new technological tools such as artificial intelligence, to some degree, that's a big umbrella, but how can that help us become better humans at care delivery for our patients and family members? And the same can be true looking at it from the patient perspective, patient and family perspective. How can these tools better prepare patients for that experience and be able to bridge that gap that exists? And artificial intelligence, I do wonder if at some point that terminology will evolve to be more augmented intelligence, because I don't, if you look at the definition of augmented, it's really to aid and support rather than, artificial has this connotation of just not being real. And chatbots, they're there. It's a real piece of technology. But it needs input from humans in order for it to be valuable. So going back to this thought of finding the humanity through artificial intelligence, like I really would reframe that to be identifying ways to connect humans through the artificial intelligence, right? Connect. And I'm not just saying like from a message, but like being able to have that connection with one another so that that patient feels known by their healthcare professional, or feels as though that individualized care is there for them, and being able to really have answers to questions that they're looking for in a way that meets their needs. I think there are great opportunities, and I wrote about some of these in my book, Electronic Health Records, that I published several years ago, Electronic Health Records for Quality Nursing and Healthcare. And one area that I still see as really underdeveloped in terms of technological support for patients is in the patient education space, right? So let's say somebody gets diagnosed with, I don't know, it could be anything from, a chronic condition to a very acute condition, whatever it may be. Let's say it's the first time that they happen to be diagnosed with, let's say it is pneumonia, right? Let's say it's like an acute case of pneumonia and the person's able to leave and go home, but needs to know how best to care for themselves. Well, that person is going to have knowledge gaps. We know that as nurses, right? Remember care plans and, knowledge deficit related to whatever it may be. But person A and person B may have very different knowledge bases about what it means to have that diagnosis of pneumonia. And we're not able to fully personalize that today in a way that they can make it be actionable for themselves. So we can give people a handout and a link to go read something, but it doesn't mean that it's hitting at where that patient needs it. And so in that regard, something like that could actually offset some of the time we know nurses don't always have to be able to go through and fully, reinforce and take the time that is more than 15 minutes. I mean, it's probably several sessions over the course of several days to be able to fully prepare someone for whatever their diagnosis might be over the next several days before their next appointment. there is opportunity for technology and artificial intelligence to be able to understand the unmet knowledge needs of that person and then provide them with the right data and information and reinforcing that knowledge to ensure that that person has the ability to be self-sufficient at home and avoid any risk factors. So there's a clear, this is my point of view in terms of how, we're in the early stage of looking at artificial intelligence in healthcare. And I think, with any new technology, and I've said this in other places, I think in one of the other podcasts, recent podcasts, with any new technology, it's not just about the technology. It's about how you're designing it. It's about how it's introduced to other people. It's about how it's getting accepted or not accepted. And if it's not getting accepted, then it doesn't necessarily matter how wonderful it is from a functionality standpoint. It's not meeting the user's needs. And so this is where, as nurses and healthcare professionals, we understand the nuances of how to help people navigate the healthcare system, whether it's within the unit that they're admitted to or the outpatient visit they're in, or just in general outside, in the day-to-day life. And that process has opportunities for things like artificial intelligence solutions to be able to be supportive assistance around data, information, knowledge, and wisdom. But it does need to be evaluated for the use case, as with any new system or existing system. And I was reading an article that was published recently in Becker's Hospital Review. And one of the comments, I'm just going to paraphrase, was that there needs to be really, a thoughtful approach towards any new artificial intelligence tool. Just because something exists and is available for use, that does not necessarily mean it has to be implemented if there's not a use case. It actually shouldn't be implemented if there's not a use case. You should not be creating a use case just to have something be utilized. And so, going back to the initial comment that I had heard around finding the humanity through artificial intelligence, I would reframe that. I would reframe that to be something more aligned with finding ways to connect humans through artificial intelligence instead of replacing some of the actions that nurses and healthcare professionals may, you know, may do that often just maybe aren't even fully realized yet. And we may uncover some of that as we get going down this space. But artificial intelligence, as a broad category, again, think about it in the perspective of augmented intelligence, sort of modifying and or enhancing your knowledge base. And I'll go back to the example that I've given before in driving with my Waze app and looking ahead to see what is ahead of me. Like, are there any roadblocks? Is there going to be a delay? Has the highway been shut down? Something that happened to me recently. And so I can't know that. I can't possibly know that unless somebody else is ahead of me. And that's just an unlikely scenario. But with the technology that can show me that, then that's a great use case of an opportunity where this technology can help me, give me more than I had before. And if it's adding on to an important piece that we didn't have access to before, and then I think it's something to consider. But a technology is just for the sake of the technology. I don't know that's what I would recommend in terms of just for the sake of saying you're using AI. Like, I don't think we're in a place where that's a a really valid reason, especially with all of the factors that go into embracing new solutions. Of course, there's ethical considerations, regulatory considerations, and I didn't touch upon that in this particular episode, but do know that risks exist and they need to be evaluated, not just from a privacy, security, regulatory perspective, but also from an ethical perspective. And ethics now extends into can you trust, can you trust it? Yeah, right? Nurses are the most trusted profession for yet again, I think it was this year, the 23rd year in a row. And so we don't want to get into a situation where trust is going to be um, at risk by association with a tool. So with that, I'm going to leave it for this episode. If you've got questions or ideas for topics that you think would be helpful for me to talk about or discuss or cover, please let me know. I'm happy to explore if they may be a fit. And I look forward to hearing your thoughts, ideas, suggestions. If this is interesting to you or been interesting to you, keep in mind we do have a program, AI 101, on iCare Nursing Solutions website that you can check out. And yeah, all right. Have a wonderful, wonderful afternoon. Take care, everyone.